Hello, Gypsies. Welcome to our second session of the day. I would like to thank Travel Nurse Across America for sponsoring our virtual conference this week. We will be having Gypsy nurse mentor Paula Rouse come on and discuss non-traditional travel nurse assignments. Since COVID has limited many of the jobs out there, some of the nurses have had to find other types of jobs away from the bedside. So that's something Paula had to do. Thankfully, bedside assignments have started to pick up a little bit, and be sure to check out the ones on our Gypsy Nurse job board. I know they're definitely picking up. So Paula will also be having a Q&A. She'll be answering any questions. So be sure to comment, ask questions, because we will be giving away $50 Amazon gift card to one lucky participant. So we'll announce that at the end. So let me bring Paula up. Hello.
Hi.
Thank you for joining us and answering these questions, and I'll let you take over.
Okay, great. Hi, guys. Thanks so much for those of you that were able to tune in. And like Rachel mentioned, I'm going to go ahead and talk about non-traditional nursing assignments. But before we get there, I want to just give you guys a little backstory on me for those of you that don't know. So I am a travel nurse, or now a contract nurse. I started off as a staff nurse doing step-down peds neuro ICU. I did that for about 2.5 years, and then I transitioned over to travel nursing. I did all of my travel nurse contracts in California. I went from San Diego to Los Angeles to the Bay Area and then back to San Diego. So I traveled out of state for about 18 months, completed 4 assignments, took the holidays off last year, and started a new job back home where I'm from in Atlanta, doing PRN float pool for the same hospital that I initially started out as staff. And I liked that job because it was PRN, it was self-schedule, and then it was a seasonal position. So it gave me the position to take 4 months off in the summer when the peds census kind of goes down a little, it drops, right? Because I only work in peds and NICU. So that was going to be the initial plan, is I was going to take the 4 months off and take a travel assignment at that time. Well, little did I know that COVID-19 had other plans for everything. As I'm sure all of you guys know, everything that's going on, and those of you working in it have been affected in different ways depending on the specialty that you work in. So for those of us that work in certain specialties, specifically peds and even NICU a little bit, OR, PACU, we were probably affected the most as far as census goes, because surgeries were being canceled left and right. And for pediatric nurses, post-op surgical patients is like a huge portion of our patient population. So when all of those things got shut down and canceled, the census bottomed out everywhere. And even though in the beginning there were crisis contracts coming out like crazy, even for peds, and you guys can go on my Instagram handle at Hybrid Flower, and I put up a whole thing about crisis contracts on there, because I had actually screened, been hired, and accepted 2 crisis contracts, both in California, for COVID-19. However, the day before I was supposed to leave, both those contracts got canceled. Now, anyone that's been canceled knows that this is like the most frustrating thing that could possibly happen to you, because I was all ready to go, packed and everything. But on top of that, I had also done all of the necessary compliance for each assignment. And since those assignments were with the same company, once I did the initial like blood work and drug screen and everything, I didn't have to do that necessarily again, but I did have to do all of the onboarding, which was done virtually before getting there. And since I got canceled the day before, it was basically just a waste of my time. And it was very frustrating, because with my home hospital where I was PRN, because I'm a non-benefited PRN employee, I'm one of the first employees to get called off. So I literally didn't work for 7 weeks in a row. So that was like 7 weeks in a row that I did not have a job, that I could not find an out-of-state contract, because not only were my crisis contracts being canceled, there were no contracts anywhere for peds, like anywhere. And I have my California and my compact license, so you would think I would have been able to find something somewhere. No, Didn't happen. I even tried to switch gears and try to take a NICU contract. However, because I haven't done full on NICU for all of my travel experience and it's been more of a blend, I was totally unable to even land one of those. And I work with 7 different travel companies, and I do that so that I always have tons of options, because those of you that travel know different companies have different contracts with different facilities. And even if you have more than one company, that if you have 2 companies that work with the same facility, the rates may be different depending on the company, right? So I like having multiple recruiters so I can kind of open myself up that way. So I had all my recruiters submitting me to anything that was open, and there was just nothing. Like, and as the days went by, the jobs were just like getting smaller and smaller and smaller. And I was super stressed. So then I had to figure out, okay, well, what can I do? Like, where can I go? And keep in mind, I've only ever worked in peds and NICU, so I have no adult experience. So going to like adult COVID unit was the last thing on my list. That was going to be like worst case scenario. And the hospital that I'm currently with, PRN, they did contract out a lot of us to neighboring adult hospitals here in Atlanta to work as COVID relief. So I did have the option to go that route if I wanted to. But like I said, for me, it was more of a worst case scenario because that just wasn't what I wanted to do. Because I didn't feel comfortable doing that since I don't have any adult experience. Because for me, patient care and patient safety should always be number one, no matter what. And I know like my experience is great in peds and PICU and NICU, but for adults, especially like adult ICU, that's like a whole nother realm that I was not ready to go into and put anybody's life at jeopardy on my conscience. So I then had to figure out, well, what else can I do? So I went on, and of course, all my other recruiters, they didn't have anything. They didn't have anything that I could do. And they kept telling me, well, you know, we can submit you for adult assignments. But as I just stated, I didn't really want to do that. So then I tapped into the other resources that I hadn't used in a super long time, as far as like job boards, LinkedIn, ZipRecruiter, and Indeed. I went on there and I first started looking for COVID screener or to be a tester, because I was like, I saw that those jobs were getting high demand here in Georgia. They wanted nurses working at certain offices, office parks, anywhere where they were doing like rapid testing or mass testing. They wanted nurses to do testing and process tests and all of those things. So I started submitting to those jobs like randomly. And then I just kind of like cleaned up my resume and put it on Indeed and put that I was looking for any type of like COVID relief, disaster assistance related jobs that would be applicable for a nurse. And I want to say it was like a couple days, and I had a company that I had never, ever heard of. I was actually kind of worried about it at first. I was like, this sounds kind of sketch. The recruiter for that company reached out to me directly and was like, hey, I'm looking for nurses to work with the Department of Health for COVID disaster relief. But he couldn't really tell me the specifics of what exactly I would be doing. He just told me that they needed contact tracers, screeners, and testers. And I was like, okay, I'll go for it. So he sent me all the information. I filled out all the paperwork, sent it in. And luckily, I was able to get on with the Georgia Department of Health, and I could stay in my home state and not travel anywhere. So that was beneficial for me, because those of us that travel know that when you do take an out-of-state travel assignment, you have to worry about housing and expenses and all of that. So luckily for me, I could do this from the comfort of home and not have to travel too far. I do commute about 45 minutes to work every day. And then I was working 9 to 5, which was way different than working 3/12s, which is what I typically do in the hospital, right? So I got the job, showed up the first day, and initially I thought I was going to be a tester. And then they asked me if I could work full-time 5 days a week, 8-hour days. And I was like, yeah, I can work full time. And then they were like, well, since you're able to work full time, we'd love to set you up to be a case investigator with the epidemiology department for the COVID disaster relief team here at the health department. And the first thing I said was, well, I've never heard of that, so I don't even know what that is. And they were like, don't worry, like, we'll train you, we'll show you everything you need. And I was like, okay. So it was definitely a whole new avenue of nursing for me that I had never explored. I didn't really know anything about public health nursing besides what we learn in nursing school and maybe one person that I know that works in public health. Other than that, I had no clue about any of it. So it was a week of training, and they set me up to learn how to do everything. They gave me my own office, computer, phone, all the stuff I would need. And then I started working there. And I've been there now since mid-April. My contracts, because I'm still contracted out as an agency nurse through a private agency, technically. So my contracts run 4 weeks at a time. So initially it was just for 4 weeks. Then they added another 4 weeks. Then they added 8 weeks. And now they just asked me to stay again for another 4 weeks. And I have a feeling, just because of the way COVID is going and the numbers not really going down, that I'm probably going to be in this contract for a while, which I'm totally okay with. Because like I said, I get to be home. I won't get specifically into the numbers, but I will say the pay is very good. It's very comparable to what I would be making as a traveler, except I'm getting the benefit of not having any living expenses because I'm home. And so that's all great. It is a non-benefited position. So this company, as far as I can tell, they don't offer benefits to their agency nurses for short-term contracts. I don't know about their longer-term contracts and things like that. And if any of you want the specifics on the particular agency, you can DM me either on Instagram or Facebook, and I'll be happy to share the details with you. So now that I've been there for an extended amount of time and they've asked me to stay even longer, I've actually been able to negotiate, since I've shown my work ethic and they're very impressed with how I work and things like that. So I've been able to negotiate, which is what I always recommend to travelers. If you are going to extend and the hospital has directly, or the facility has directly asked you to stay, then you need to always advocate for yourself first and foremost and be like, well, then what do I get? Like, you guys need me here. You want me to stay. So what do I get in return? So for me, it was dropping down to part-time because 5 8-hour shifts was just a lot. And after doing that for 4 months, I was like, okay, I cannot like work 5 days a week anymore. Like, it's just too much. So I dropped down to 3 days a week, and that's been way better for my schedule. So basically in my job description, what I do is I am responsible for contacting, because the Georgia Department, the Department of Health for every state is broken up into multiple districts throughout the state. So the district I work for is over 3 counties in Georgia. And what I do is I contact patients in those 3 districts that have been hospitalized for COVID-19. And then for those patients that have died from COVID-19, I call their families or their representatives, and I follow up with them to try to trace where they might have gotten infected and who they exposed themselves to before they either passed away or before they went to the hospital, even after they got out of the hospital, if they had contact with anyone, all of that stuff. And then I talked to them about medications that they were on, treatment plans that they were prescribed, and the symptoms that they had, just to see if it correlates among like other, like all the data that we have, or if it's different. And it is very different. It affects everybody so differently. Past medical conditions, like things like that. So the biggest thing with this job is it is away from the bedside. That's the biggest thing. It doesn't have any actual face-to-face physical patient contact, which is what I had only ever done before now. I'm on the phone a lot. I'm on the computer all the time. It's a lot of documentation, because when I take a case or a patient's file, it will take me anywhere from 1 to 3 hours to complete it, depending on the extension of everything that goes with it. Oh, hey, Haley. Hey, Haley. Yeah, it is actually like being a detective. That's like the best way I can describe it, because you have to be very good at talking to people, which at nurses, like we are, obviously, but you have to know like the right questions to ask, because you need to know if that person went to work and who they were around to try to figure out where they may have gotten it from and who they also might have infected. And then you have to follow up with all of those things. Like you have to follow up with all the people they had contact with and their employer. And that's how we usually find out about outbreaks at multiple places and things like that. So it's super interesting. It can be very stressful. Those of you that follow me on Instagram can definitely catch my Instagram story rants when I've had a bad day and I need to vent. I do have my little vent sessions on there. But I will say it's very rewarding, because the time that I spent not working, I felt like I wasn't contributing to the cause. And I feel like COVID-19 has made a lot of healthcare professionals feel either like burned out or overworked, or that we're not really helping if we haven't been able to. So this was my way to get involved and help and do something to feel like I'm making a difference. So for that, I'm really like appreciative of it. Right. So, and like I said, it is super interesting. It's exposed me to a whole aspect of nursing that I had no idea about. Public health nursing is so big, and I didn't know anything about it until now. And it's actually very interesting. And I'm not going to lie and say that it's just been a huge adjustment. For one, like the shifts were way different, because I was working 3 12-hour night shifts and then switching to 8 5-day shifts. Well, that was a whole big adjustment on its own. And then switching from bedside nursing to non-bedside nursing has also been a huge change, because I do have like management and supervisors like I would in the hospital, and the chain of communication, there's still like one of those that I have to follow and whatnot. But it's just, I don't know, it's just different. And it is stressful, but it's a different kind of stress, because I feel like when you're at the bedside as the nurse, you're such in high demand from so many people. And that can be very stressful, because you have doctors, physical therapists, respiratory therapists, pharmacists, patients, families, everybody trying to pull you in multiple directions at a time. And that can be a lot for anybody to handle, especially depending on the specialty that you work in. And then with this position that I'm in, I do have like multiple people trying to like get my attention for things, but it's nowhere near as stressful as bedside nursing is. I will say that. It's a different type of time management and task efficiency that I've had to learn, but the challenge has been really welcomed, and I feel like I've done really well with it. So I'm happy with it so far. And I'm just enjoying, like, I miss patient contact. I won't say that I don't. Like, I miss my kids. I miss my babies. I miss all of that for sure. But I don't miss everything else that goes into bedside nursing. And those of you that work bedside can understand when I say that. Like, I don't miss everything else, which is why I love travel nursing, because it took away from all of the extra stress that staff nursing adds. And I'm happy to not have to worry about that with this job either, because I'm a contracted nurse and I'm not a Department of Health employee. So as far as all the things that are required for them, I don't have to do any of those things because I'm contracted through an outside agency. But since I do work on the disaster relief team, I am a part of weekly meetings. Like, I usually have 2 or 3 meetings a week. And even though I work part-time now, I still have to call into those Zoom meetings and be a part of them. So I'm kept up to speed, because we get information directly from the State Department, which comes from the CDC, and everything changes every single week. It's like something different or being modified or changed. So that is a lot different as opposed to when I was working in the hospital, going to like so many meetings and things like that. So that's been an adjustment as well. However, like I said, it's been a welcome challenge that I appreciate. And those of you that are looking for non-traditional assignments, the health department is a great place to look for jobs. Not even necessarily if you want to work with COVID, it also has so many other opportunities for nurses as far as immunizations, outbreaks, STD management. Like there's so many different departments that they offer that they need nurses for. And a lot of times nurses work as like team leads, and you'll have LPNs that work under you, because the health department, at least the one here in Georgia, I know there's clinics that are run specifically by the health department, and those clinics are manned and operated by a nursing staff. So that is something that if you guys want to look into, that I would recommend if you're looking for something that is outside and away from the bedside. And hold on, let me refer to my list here. Some other assignments that you guys can look into would be any type of like clinic jobs, outpatient jobs. If you're looking to get away from the bedside, those would be considered non-traditional, because a traditional nursing assignment is in the hospital, 3 12-hour shifts or more, depending on the type of contract that it is. So like a clinic or outpatient center, those are going to be on the non-traditional side, right? Also, a lot of smaller nurse agencies staff for home care. If any of you are interested in doing home care or like private duty nursing, that's a whole nother avenue of nursing as well, that you can work as technically a traveler or a contracted nurse. So those are also some opportunities that you can look into, especially if you're not willing to travel outside of your home state right now. You can definitely look into home care through like a privatized agency. And I know with some of those agencies, you can set your own schedule and like determine how far you want to travel. And depending on the agency that you work with, your benefit package may vary. It just depends on the agency, right? But that is a good option for those of you that are not willing to travel outside of your home state right now and are wanting to stay close to home. Like I would definitely recommend pursuing home care. I know I've had some friends that are peds travel nurses that are doing home care nursing right now, because there was a high need for that, since a lot of families are not bringing their kids into the hospital for every little thing, and they're trying to manage more things at home, especially families that have medically complex children. So they're requiring more home care. And if the parents themselves are working from home, then they definitely want like a nurse there that can do meds and feeds and things like that, so that they can work. So that's a suggestion. If you want to do like what I was looking for, like COVID screener, a biometric nurse, you can search for that. Companies will hire nurses to do biometric screening. And a big part of biometric screening right now is COVID screening. So I know some companies have contracted out nurses to contact their employees to find out if they've had any contact with anyone that's had COVID, to screen them for symptoms as people are returning to work now. So that's another thing that you guys can check out and see if that's offered in your area or somewhere that you'd be willing to travel to. If you want to do something like more from home, then a nurse auditor is always like a good job that you can look into. That's where you can either work with so nurse auditing is where you review patient medical charts, and that's offered, I know, as a contracting job through certain agencies. So you can look into that. And I want to say the couple people I've talked to that have done it, the company has sent them like their own computer, their own work phone, and they set them up with all the software that they need, and they just review patient charts for errors. And I know there's another nurse auditing position where you can review patient charts for billing for insurance purposes. So that's another position. If you want to go work in a call center for like an insurance company like Aetna, Blue Cross Blue Shield. All those companies hire nurses to do a little bit of triage, and then I know they also hire them to do screening for billing depending on like what needs they have and if their medical needs are met by insurance coverage and like all that stuff. So that's another thing that you guys can look into if you are looking for something that's outside of the bedside and you're wanting a break, or like myself, it's hard for you to find a contract right now. And even if you're staff in peds and you're not working as much as you normally are, or if you're staff in OR and your hours have been cut, like those are all good jobs to look into. If you're one of those people that's like really big into social media and like self-promotion and things like that, I know some nurses that have pursued getting their to be like a health coach. If you want to do that and set up like your own thing, then that's always like a great way too. And I know you can work from home doing that. I don't know very much about that, but I have talked to some people and that's what they pursued, that route, and they really like it. Because I mean, it's so crazy now that in the middle of a pandemic, so many of us have been affected with not being able to find a job. It's like a huge percentage of nurses that are being like overworked and burnt out, and then another huge percentage that are like laid off or furloughed. And then I actually got like, I had 4 months off from my hospital, and then they sent me a letter saying that I was technically furloughed until September 1st. So I'm in the position right now to try to figure out what to do. Luckily, this, like I said, this contract that I'm with, like they still need me there. Like the demand is still really high. So I'm probably going to just ride this out as long as I can and then see what happens. Because I feel like even when the census where I do work starts to pick up a little bit, I probably still won't end up working. Since I'm a non-benefited PRN employee, I would be one of the last employees to come back because they still have so much actual staff that's being called off like 1 or 2 shifts a week. So I'll probably stay in this current contract as long as they need me for, which I feel like is going to probably go until the end of the year. So we'll see what happens. Like I said, I welcome it. And if not, then I will also take a well-needed break. Because in the past, I've normally taken 4 to 6 weeks off in between contracts. So if that has to be the case, then that has to be the case. But what I will encourage you all to do is that if you do find something, just show your best work effort. Embrace it, embrace the change, embrace the challenge, and then just like make it your best situation, you know, and then try to save as much money as you can because you don't know how long that contract is actually going to last, right? Even if you land a traditional nursing contract, because cancellations are still super high. So I would say try to minimize your living expenses as much as possible, save as much money as you possibly can, because the contract could literally end at any point and you don't know how long you're going to have to wait before landing another contract. Unless you work adult ICU and you are like fine with going and doing a COVID unit, then you guys will have contracts for a while, obviously, because the numbers are going up and hospitalizations are way up as well. And let me see. So I know some people had asked me if I'm missing the bedside. I touched on that a little bit. I miss my patients. I miss like working with some friends, obviously, but I don't miss the stress. Like I said, I really don't miss the stress at all. This has been a new type of stress that I'm adapting to, and that's been different. I miss night shift because I'm like a hardcore night shifter. So this day shift has been very difficult for me to master. So I do miss my night shift schedule. I do miss only working like 3/12s and then setting my schedule to where I can be off for like 6 days in a row. I miss that. But like I said, luckily for me, I was able to negotiate and go down to part-time with this current contract while still keeping my same pay rate, which was amazing. And so now I have like 2 days out of the week off, which is nice. I mean, including the weekend, but I only have like 3 full work days because I work 3 9-hour shifts now. So 27 hours a week, which is a little bit better for me instead of 40 hours, because on top of everything, I'm also in school to get my FNP. So that's like taking a lot of my time as well. So working 5 days a week was not super ideal on top of doing school. So that's what's working for me. So that's why I said, if you guys do find something that's like totally outside of your comfort zone, just like be open to it, explore it, show that company like that you have great work ethic so that they are willing to keep you around, and not even keep you around so you can have better negotiation tactics, as far as if you've been there for 3 months, and then they'll be more willing to want you to stay, right? Even if they put you into a different role, then, you know, like if you show that you have great work ethic, then they'll obviously want to keep you around. And like having a job right now is huge, especially if you're not willing to work in certain areas. You know, if you're wanting a break from the hospital, if you land one of these like non-traditional jobs, like try to keep it as long as you can, is the biggest thing I can stress to you guys for that. And I think I touched on everything. I tried to hit on the major points from the poll that Rachel had put up. Let me go through these comments here. And then if you guys have any questions for me, go ahead and drop them now in the comment box so I can kind of see and respond. How do you maintain being positive in what can probably be very depressing? So that's a great question. It can be super sad, especially if I have to call a representative or family member of someone that has died from COVID. That can be a little difficult, right? Because sometimes another thing is that when I'm reviewing, so when patients have been hospitalized or have passed away in the hospital, I'm reviewing their chart that the hospital has faxed over to the health department. And sometimes they don't fax over the entire chart, so I don't even have all of the information. I just have like some of it to work with. So that can be a little stressful too, because I'll have like the date and time of death, but it's hard for me to shift through everything to see, and I might be able to find like the day they were admitted, but I can't really see the progression of what happened. So I'll have to talk to the family member about all of those things, as far as like, well, why did you first take them into the hospital? And then were they admitted to a regular floor? And then were they transferred to the ICU? And then what day were they intubated? And how long were they intubated? And all of these things, right? So I have to ask all these questions. And that can be very hard sometimes, especially if I have to talk to like a spouse or son or daughter of like a parent that's passed away from COVID, because I need the information like right then at that point, especially for contact, to get all that information forwarded over to the contact tracing team so they can follow up with everyone that the person may have had contact with before they were hospitalized. So that can be a little hard because people are obviously grieving and they're upset. I just try to get them to understand like what we're doing, and that's limiting the spread, and we're trying to lower the infection rate and of course the death rate in our state, right? And the only way that we can do that is to get a handle on it, and that's by figuring out how it's spreading and who it's spreading to, right? So, and I think if you've worked in the bedside and you've lost a patient or you've dealt with that kind of thing, then you kind of develop a mannerism and tone that leads you through how to have those conversations. So that's something that I do have experience with, unfortunately, but it has prepared me to do that, which makes it a little bit easier. But I would say if you didn't have that, it would be more difficult for sure. And I just try to, the biggest thing for me to stay positive is, like I said, to know that I'm making a difference and having an impact on this. And that's kind of keeping me from getting too upset. But I do have really bad days too, where I'll go home and definitely like feel terrible. But I think all of us are dealing with that right now, right? We just have to find good outlets for our stress. We just have to find an outlet. Okay, let's see. The chart review job. Oh, so the nurse auditing job. So if you just go on LinkedIn and in Indeed, or really if you just Google like nurse auditing job, and then you'll see a bunch of stuff that will come up, and you might have to just follow through with individual searches that pop up for you. And from the ones that I saw, like, you didn't need crazy experience. I think they just wanted like 2 to 3 years in like a patient care type setting, and familiar, like as long as you were familiar with like Microsoft Word, Excel, different programs like that, and then you had been used to using like a EHR system like Epic or Cerner or things like that, like then that will help because you'll be familiar with the charting. And then all of them offer training, virtual training right now because of COVID as well. I did see one the other day that was like you had to go and do like in-house training for 4 to 5 days, and then they would supply you with everything. So if you want to start there, and hopefully that will be helpful. And let me see. Am I recruiting for the? I'm not recruiting for this, actually. And like I said, if you want the details of the specific company that I work with, you can send me a DM either here on Facebook, or you can send me one on my Instagram handle. You can find me on Instagram at hybridflower8, like hybrid and then flower. You can find me on there and send me a DM. I always encourage like anyone that needs any type of help to just send me a DM. I'm pretty open with like sharing everything. So just like let me know what you're looking for, and if I can help you, then I will do my best to help you. I think I got, oh wait. Only experience in peds. Hardest aspect of your job. Do you feel like the job is harder because you don't have prior experience with adults? Okay, so I thought it was going to be that way, but actually it's not. I will say that sometimes I do, when I get into patients like underlying conditions and like medications that they're currently taking, because disease progression is different in adults than in peds, right? That can be a little overwhelming. But for the most part, I haven't had that experience. And I do have like my supervisor, she's a nurse. So if there's anything that I'm struggling with, I will just go to her, especially with like a patient chart. If it's very complex and there's a lot of things going on and I'm like, I have no idea what this is, I don't know what this means, then I'll just go to her and ask her. But for the most part, when I'm speaking to patients or their families, I can pretty much get all the information that I need. I might just have to follow up with someone else for the documentation part of it. And that's usually like helpful. But I don't know if I could do like phone triage nursing. I don't know if I could do that for adults. But I do know like that my hospital, that like the children's hospital I work for right now, they have their own call center. I don't know if it's like that for other children's hospitals in different states. You can look into that if you want to do like call center triage nursing. You can look into that and see if that's an option if you wanted to do something like that. See if it's offered in your that relates to your specialty, if you wanted to do something like that. And then the hardest aspect of my job right now, I probably have to say the education piece, because it can be very repetitive with teaching the same things to people every day, all day long, as far as like wearing a mask, hand washing, social distancing, like that can get a little tiring. And then I say education too, because it can be very frustrating to give but it's the same thing when you're actually working, right? You give all of this information to your patient and your family on how to like get better and steps to follow, like on discharge, like all of those things, right? But we all know that they are going to do what they want at the end of it. But all you can do is like your best and know that you did everything that you can do and try to like let that sit with you, right? And move on from there. But that's probably the most frustrating thing, is just giving all this education and all this information. And I will still have patients that will tell me, well, I'm not going to do any of that. I still don't believe I even have COVID-19. I don't think COVID-19 is real. Like, there's still a lot of people that believe all of those things, right? That it's a conspiracy and that it's not a real infection. And that can be very frustrating. And then I'll have patients that will not tell me where they work, will not tell me where they've been, will not give me the close contact information, especially for their household contacts if they live with 5 or 6 other people, and then those people have now become symptomatic, but they won't give me any of their information. So that can be very frustrating and very difficult. And that's probably the hardest thing, I think, is just getting people to really understand the severity of what can happen with this disease and how it affects everyone so differently. That's the hardest thing, is getting people to really take it seriously when they don't. And as a nurse, all you want to do is like educate and help them, and they just don't want to hear any of it. And then they hang up on you too. I've been hung up on several times. And like I said, but we deal with that in the hospital as well. People are very set in their ways and mindset, and the only thing that we can do is give them the information and educate them and hope that maybe something that we said stuck and they'll reflect back on it and change. And then if not, at least you know that you helped someone else and made a difference that way. That's kind of like what I interpret it as, and go from there. And I feel like I am making a difference, even with the people that don't appreciate me or don't want to talk to me and don't want to give me their information. I feel like there's still more people that are taking it seriously. And I feel good when I talk to patients and they're like, I'm so glad you called. Like, I'm so glad that you're going to follow up with my employer and make sure that it's going to be safe for me to go back to work, and to make sure that all my coworkers like are aware and that they're not, so there are a lot of people that are appreciative of the efforts that we are doing. And I think you just have to focus on those things and not let the bad experiences like outweigh those, and just like try to stay as positive as you can. Be my takeaway for that. And I think I answered everything. Anybody else have any other questions or anything else I can answer? I hope those of you that are looking for something away from the bedside, that you do find it. I feel like I was very fortunate to find this. It literally fell into my lap. And I wish all of you guys the best. Don't give up. Persevere as much as you can, especially if you're not working and you haven't been working for a while. I understand. I was there with you. If you've been canceled, I was there with you also. I definitely get it. It's hard out here for some of us. And like I said, if you are fortunate enough to find something, then just stick with it as long as you can and make the best of it, because it might be all you get for a while. And for all of you that are continuing to work actively with COVID in the hospital at the bedside, thank you so, so much for everything that you're doing. I am sending you guys all positive vibes to just like stay safe and just power through, because I know you guys are really, 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 really working out there with limited resources at that. And I just want to remind you guys to remember to advocate for yourself, especially if you're on contract working a COVID contract. Make sure you're getting compensated properly. Make sure you have enough PPE. And if you don't, remember that they wanted you there and you do not have to stay there. So advocate for yourself first and foremost. Like protect your health and safety more than anything. And I just want you guys to remember that, because I think sometimes we get so caught up as nurses, like being that we have to help, we have to be there. But remember, you are a priority too. You can't take care of anybody else if you get sick. So advocate for yourself, make sure you have safe working conditions and proper PPE, and you are getting compensated for your time, because you are working and you deserve to be compensated for that. And good luck to all of you. Thank you guys so much for your time. If nobody has any other questions, then I'm going to have Rachel come back on.
Thank you. And yeah, good point too. Thank you everyone that is still out there fighting that fight. And thank you, Paula, for giving other people options, like other ideas. Like I know a lot of people want to help, but maybe they're unable to really get in there in the front lines and really like, you know, go to the hospitals and go far away. They might not be able to, but they might have that internal struggle of like, well, I really want to help, but I really can't get in there in the deep part. So, I mean, thank you so much for giving us some other options besides, you know, in the hospitals and other ways to really help. So we appreciate that. So let me do our drawing for the Amazon gift card. So we're going to use
that's right. Exciting.
generator from Google. Okay, so it is Samantha Rumley. So if you could just message our fan page, we'll send you a $50 Amazon gift card. So thank you everyone that participated. Thank you, Paula, for coming on. We love having you on here.
Thanks.
And we look forward to more sessions from you. So thank